Period.
ಲೈವ್ ಸ್ಟಾರ್ಟ್ ಆಗಿದೆ.
Okay, Chaitra, you can start now.
Om Shri Dhanvantare Namaha. Om Shri Gurudevaha. Good evening to one and all present here. I would like to welcome you all and start the session with brief introduction about the Jignasa and the program. Jignasa is a pan-India initiative exclusively dedicated for Ayush students and the Ayush education system, with the aim of safeguarding the health and understanding the medical methods and theory that comes under Ayush. Jignasa implements various student-oriented and society-beneficial activities with its motto, Learn Ayush to Practice Ayush. Today, Ayush is gaining prominent portion in the global health system, so there is a need to empower our education system towards this global challenge. For this, Jignasa is trying to bring together the medical students, teachers, doctors, and administrators of Ayush system together in order to bring the desired changes. In ancient India, young seekers would approach learned sages with one burning desire to acquire knowledge and excel in their chosen path. The sages, in turn, would not only teach them but also prepare them to apply their learning effectively in real life changes. Inspired by this timeless tradition, Yashasvi Bhava, Prepare, Perform, Prosper, has been designed as a beacon of guidance for second prof BMS students. This program is our modern day Gurukul, a comprehensive exam oriented series tailored to help second prof BMS students master every subject with the support of expert professors. With features like dedicated doubt solving session, model question paper practice, and daily classes aligned with the CBDC curriculum, Yashasvi Bhava ensures you not just prepared but empowered to excel. Let's begin this journey of preparation, performance, and prosperity. Today, we are honored to welcome Dr. Ashok.S.Bingi sir as today's speaker. Sir is currently working as professor and HOD in Department of Agada Tantra in Sanjeevini Ayurveda Medical College and Hospital, Hubli. Sir has completed his BA/MS from Ayurveda Mahavidyalaya, Hubli, and MD in Dravyaguna from Sri DGM Ayurveda Medical College, Gadag. Sir has presented 4 papers, international, national, and state level conferences, and has published 2 articles in regional daily and weekly newspapers. Sir has attended more than 10 international, national, and state level conferences. Sir has totally 14 years of teaching experience and worked as a duty doctor in City Clinic, Hubli for 1 year and treated more than 4,000 patients of various health conditions with Ayurveda modalities. I welcome you, sir, and now I would like you to continue the session, sir. Thank you.
Thank you, madam. So, good evening, everyone. All my dear students, for understanding the exam pattern for the Dravyaguna Vijnana Paper-1. Easily, you have to learning and every minute or every seconds. So, the exam pattern will be answering the strategy of the exam structures, total 100 marks as per the university guidelines or NCSM. Duration will be 3 hours. First questions, multiple MCQ, 20 questions, each question having 1 marks in 20 marks. Short answers, 8 short answer into 5 mark questions, there are 40. Long essay questions, 4 into 10 into 40. Total 100 marks question papers. There will be different kind of categorized the question will be arise in the systematic order, MCQ or short answer, long essay. In Dravyaguna Vijnana, MCQ will be 1 marks. No other 5 marks or 10 marks. In Dravya, totally 6 marks. First MCQ 1 marks and other 5 short answer 5 marks in each question. Guna. In Guna Vijnana, you have to total 11 marks, 1 long essay, 1 MCQ. In Rasa chapter, there will be same as it is one long essay, 1 MCQ. In Upaka, 1 MCQ in short essay. In Veera chapter, there will be total 6 marks, 1 MCQ, 1 short essay. In Prabhava, there will be 5 marks, only short essay. In the Karma chapter, there will be 1 long essay, 1 MCQ. In the Karma of Dashamani Ganas, there will be short answers. Principle of general pharmacology, 20 marks, either maybe MCQ or long essay. Misraka Ganas, there will be 1 short essay, 1 MCQ. Nomenclature of the Dravya as per the Nigantus or Vedic taxonomy and botany. There will be only 1 marks, there will be MCQ. Prasasta Baisaj and Prasasta Pariksha and the drug and evaluation method with correlation of the as per the pharmacognosy. There will be 1 MCQ. Dravya Sangrahana Kalas. Dravya Sangrahana drug collection methods as per the GMP, good field collections. There will be 1 MCQ. The general methods of R&D, rear end generation product medicine plants, there will be 1 MCQ. Above Pratinidhi Dravyas, there is substitute 1 MCQ. Classification and techniques and aqueous and alcoholic extract 1 MCQ. And adverse drug reaction and pharmacovigilance with the recent updates 1 MCQs. There will be 1 marks. And some of the National Medicine Plants Board and CCRS and Central Council of Research in Ayurvedic Science API. In this, all the object of the only 1 MCQs, the Ruksha Ayurveda and ethnobotany, ethnomedicine. There will be 1 MCQ. Network pharmacology and bioinformatic. There will be 2 MCQs. There are 20. There are lot of problems in the MCQs and different aspect of the MCQs and long essay and short essay. The already substitute the duration will be as per the NCSM. In a long essay, questions will be maybe or may not be comes this way. Clinical importance of Lagu and Ruksha Gunas. Or second question, explain Yumshati Gunas and its clinical importance. Then third question, Paradi Gunas and its clinical importance. That discuss Guruadi Gunas in context to its karma on the dosha and dhatu and malas. Otherwise, you have to explain direct questions in the different aspect. There will be in Guna chapter and Karma chapter and Rasa chapters, there will be asking the long essays. In the write the definition and lakshana of the Rasa and its importance. Like you have to ask the questions. My dear students, you have to use different aspect of the karmas, either maybe importance of karmas or importance of gunas or important general principles of pharmacology. In this way, for examples, write the definition of rasas. You have to write the definition, either maybe you have to know the slokas you have to written, then you have to explain. Then lakshanas, then guna, all rasadi gunas. You have to write the on the basis of, for example, Shadrasas, you have to all the pharmacological actions, Madhura rasas. In Ati Yogas, you have to excessive consume the Madhura, for example, Madhurasas. What happens? There will be likewise, you have to use the long essays. Otherwise, you have to guna karmas, write it in detail about the gunas. You have to definition, lakshanas, then importance of gunas and applications. In paradigma, for example, paradigmas, Paratogurta, like that. You have to all 41 gunas, you have to explain and you have to write and important and clinical aspects and research aspects. What are the, you have to use the, then you have to explain Ati Yoga of all the Shadrasas. You have to come this, it may be or may not be. You have to use, change the questions. There will be twisted questions. Explain the definition of clinical importance and karmas mentioned in the syllabus. As per the syllabus, you have to explain karmas. In the clinical importance of Guruadi Gunas, there will be 4 questions. You have to make it, you have to write properly. You have to understanding the questions. Then you have to write. First, you have to come to in your question paper in your hand. You have to read it and thoroughly, then you have to write. In short essay questions, likewise, write classification of Dravya according to Prabhava. There are classification of Dravyas, different dosha vedena Dravya Vargikana, Guna vedena Dravya Vargikana. Likewise, you have to use the according to what are the question will be there. You have to understand the question, then you have to write according to Prabhava and according to dosha vedena Dravya Vargikanas. Likewise, you have to write, you have to thoroughly, you have to buy or you have to practice and you have to read. Either maybe it comes under the by at the slokas, you have to write slokas, then you have to explain in discuss Divida Vipakas, for example, Madhura and Katu Vipakas. Madhura Vipakas, what is Madhura Vipakas? Then you have to write definition, then lakshanas, then you have to how to effect on the applicate in the applied aspect in research activities. You have to, is there any work on this way? And third one, write about Ushna and Sita Veera Dravya in clinical approach. The Ushna gunas, what is mean by Ushna? What are the qualities which dosha will be increased, which dosha will be decreased, and the effect of dosha, dhatu and malas. So you have to differentiate, you have to write, then you easy to understand in the gunas. Then you have to write. Otherwise, you have to very difficult to write. Some of the students are you have to write only Ushna guna is reduce the weight reduction and kapha will be decrease. Likewise, don't write this way. You have to write what is mean by Ushna guna, what is my Sita guna, or any gunas. You have to write all those things here, then you have to apply it. In write the Prabhava Lakshana explain with exams. Prabhava, the dosha, dhatu and malas. Whatever you have to use the any dravyas. Or for example, Lakshana of the any rasas. Either maybe you have to use the dravyas, lakshanas, gunas and pharmacological actions of the particular rasas. Then environmental dravya in Balya Dachamani Vargas in the comes under the according to Charaka Samhita 50 ganas. You have to add any one gana is comes in the short essay. For example, Riddhyaganas. Riddhyaganas, you have to the definition of Riddhyaganas. Riddhyagana, then you have to write it all 10 drugs. You have to add the any sloka, Dashamani. For example, Riddhyaganas, Amra, Amrataka, Lakucha, Karmadha, Rukshamla, Amlaktesa, Marijajimoda. Likewise, you have to use write it and properly the mode of actions of Riddhya. The all 10 drugs, there will be Rasa Panchaka you have to write. Then you have to the applied aspect of that Vargas. Any Vargas, Jivaniya or Brahmaniyas, Kantya, likewise. The definition of pharmacological action explain route of drug administration. There will be different types of route administrations. You have to which drug you more effective or you have to write all the routes. Then the applied aspect of the route, there will be either maybe quick actions or delayed actions. In acute conditions, which route will be in the applied aspect of the all the route of drug administrations. There will be right according to Charaka Samhitas, Susruta and Vagbhatas. There will be different kind of, there will be 5 number or 10 number. Prabhakta, likewise, Prabhakta, Madhyabhakta, Adobhakta, Grasa, Grasantare. You have to write all those things which Prabhakta, where it indicates which disease will be, you have to apply. Likewise, you have to write it in detail, within a short. There will be, you have to explain everything, you have to write in applied aspect of the that particular routes. In pharmacokinetics, you have to write in various aspects in the pharmacokinetics, in the Dravya. All the, you have to use the any drugs of the Dravyas, drugs, you have to use the any different aspect of the pharmacokinetics, either maybe applied aspect, research aspect, and then you have to pharmacokinetic. You have to describe the definition for what is meant by pharmacokinetics, then where it used, what are the modality of the pharmacokinetics. Then another Dashamulas, write its Gunakarma. You have to write Dashamulas. Write it Dashamulas, then all Dashamulas pharmacological actions. Rasa Guna Rasa Panchakas. Rasa Guna Veera Vipaka, then Prabhavas. Write it. Then you have to use the applied aspect of the which, or is there a research, you know the research work you have to write. In multiple choice questions, there will be Dravyaguna Vijnana is known as, there will lot of question will be arising. In the Dravyaguna Shastra, you have to vast subject. Kshanakshara Chaiva Vidyadanam Sarvadanam. You have to collect the materials or knowledge about the any single minute or single seconds. You have to collect the knowledge of the Dravyas. Likewise, even according to NCSM syllabus, MCQ will be Dravyaguna Vijnana. There is Dravyaguna Vijnana is known as, one is Dravya Vijnana, second Aushadhi Vijnanas, Karma Vijnanas, Rasa Vijnanas. Like you have to choose. Correct answer is Dravya Vijnana. The following is not an example for the Swastha Ita Dravyas. Likewise, you have to, so many questions you have to come under this way. MCQ is 20 numbers. You have to write specific answers in specific questions. In Madhur Rasas, for example, Madhur Dravyas, have Sita Veera will have usually dash vipakas. Likewise, you have to different also in Madhurasa, in the absence of Madhurasa, other Amla rasas or Katu rasas, you have to multiple, you have to twist the questions in a trifle. It comes another which Upaka. Likewise, the is the primary purpose of the seed bank in the according to NCSM syllabus. Seed bank will be there will be a topic you have to store in the medicinal plants in plant extract. What is mean by otherwise you have to write only you have to seed bank. You have to question will be define seed bank. The definition of seed bank you have to write. What is the purpose? What is the use? You can write. The seeds will comes under the further futures. Likewise, or you have to store in the medicine plant extract or whatever it may be. You have to use multiple in the seeds. So in this aspect, you have to use the in this the seed banks most probably you have to ask in the there what is the primary purpose of the seed bank. Then you have to use or define seed bank. In MCQ, it comes under the MCQ only. Some of the question paper or you have to any teachers you have to twist the question. You have to use the two questions. You have to combine one questions. Either maybe short essay or short answers. Which of the following is a key aspect of good cultivation practice? That is GCP for medicine plants. Either uses of chemical pesticides and fertilizers, the maintenance of the products, other chemical or maintenance of the harvesting or any other harvesting, random collection of the medicine plants from the wild, use of genetically modified seeds. There will be there is MCQ. You have to use this way. You have to asking the some of the teachers will be twisted and you have to properly thorough. You have to write it either maybe A or answer A or B or C. You have to B. You have to write A. You have to write. Some of the students are very blunder mistake. The question number 11 MCQ or 12 or any numbers. There will be MCQ numbers. You have to write or only you have to be. Don't write. You have to feel write it properly. Full of answer. There, what is the primary purpose of seed bank? There will be A to store medicinal plants extract. You have to write. Then you have to put number of marks. Otherwise, you have to put a half marks only. So you have to don't blunder mistakes. What does REET stand for? The context of medicinal plants? Rare, endangered, and threatened, and restricted, and endangered, and trade, and rare, exotic, and traditionals. Research, extraction, and trade. These are the questions comes in the MCQs, almost all in this aspect. There are in 20 number, you have to each questions having the 1 marks. Just like a mathematics. In substitute for the Ati Vishas, Vatsanaba, second one Mosta, ST Madhu, Ashoka. If, for example, in the substitute of Ashokas, some other drugs, you use a Kastadaru, it is called a Nakli Ashokas. Common chemicals used for alcoholic extract, ethyl or methyl angine, and chloroform. There will be different ethyl alcohol. It can be used in the extract of the alcoholic extract. The reporting system of untoward effect is known as pharmacology, pharmacokinetics, and likewise you have to asking the question like this. In the GCTM main center is located New Delhi, Jaipur, or Bangalore, or Jamnagar. In the you have to likewise you have to ask the questions. Author of Ruksha Ayurvedas in Charaka, Surpal Narari, and Madanapala's Ruksha Ayurvedas. How many pharmacovigilance centers are there in India's? Either maybe 20 or 30. You know about the 63 in number. How many pharmacovigilance centers are there in India? 63 is a right answer. There will be different kind of numbers will be mentioned in the all the four. One is right, other three will be wrong answers. You have to proper write it and see, then you have to write 63. Tool used in the network pharmacology for collecting target genus, blind database, disgenet, KEGG, and ball. Like what you have to ask the questions. In the time management is very important. Each and every students. Some of the students you know about the questions, but you have to write very slowly. The time will be consumed more or one questions. You have to lot of problems in the examination. There will be you have to properly you have to read and you have to dividing 50 marks will be comes you have to do the only 1.5 an hour, then 1.5 hour will be you have to use that you have to time management. Avoid spending too much time on one question. You know about the questions, but you have to write all the 50 pages, but only single answer will be only you have to maintain the timing and how much question marks will be there. You have to know the marks. You know about the unnecessary time killing questions. You know the all the aspect of you have to write within the time. In 10 minutes, 10 marks questions, you have to write 20 minutes or 15 minutes. You have to write each page having the 2 to 3 minutes or maximum 4 minutes each pages. Some of the people are you have to write more than 10 minutes one page. The presentation should be the presentation you have to clear cut what is mean that what the question paper in the question numbers, then you have to you know about the question, you have to write properly definition, lakshanas, and gunas, and then otherwise you have to explain the different ways, or you have to write in the lengthy answers, or you have to unnecessarily nothing will be there in the that will be content of that answer. Only you have to fill the page, all 50 pages, then each page having one marks, there will be, I will be passed. No. The teachers also having the same, you have to, how to write the, you have to, first page, you have to impression, the definition, lakshanas, gunas, there will be, for example, write in detail about the Madanapala Nigantu or the Navantar Nigantu or any Nigantus. in Bhava Prakash Nigantus. In 10 marks questions, you have to write the Nigantu of Bhava Prakasha, the author of Bhava Prakashas, the period, Kalas. You have to write. Then you have to all the 24 Vargas in the that particular Nigantus. First Varga, which Varga are either maybe Gudchadi Vargas. Why Varga explained in the Gudchadi Vargas? What is necessary? How many drugs are there in the that Gudchadi Vargas? You have to write in the proper channel or one by one Vargas you have to explain. Otherwise, you have to mention the all the 24 Vargas. What is the importance of the Bhava Prakash Nigantu? Then you have to how to utilize the Bhava Prakash Nigantu in the ancient period. You have to write that you have to know the Bhava Prakash, but you have to concise the answer. The presentation very clear, use clear handwritings. Some of the people are don't the first letter will be good. Other you have to write one line statement. Is there any underlining headings and keywords? You have to underline it. There will be impressive of the evaluator. Then you have to use the that will good number of marks. Otherwise, you have to subheadings. You have to write subheadings. Numbers. Is there any? For example, the total number of gunas according to different authors. You have to write Charaka, Susrata, and Vagbatas. Though in this way, you have to underline the headings and subheadings or numbers. Then content, the strict and question scope. There will be scope of the questions. How much right? How much marks you getting the marks? Even so, totally avoiding the unnecessary. You don't write the unnecessarily. Whenever you have to, most of the students are you have to write all the 50 pages. All the 50 pages, but you are getting only 7 or 17 marks. I know so many students are written 50 pages, nothing will be, you have a good number of marks. You have to content and clear of the handwriting and keywords and the uses of clear handwriting or underline headings and keywords. Then what is the question will be there? You have to answer according to questions. Define Dravya, write its importance. The definition of Dravya, then you have to Lakshanas and importance of Dravyas. Then classification of the Dravyas. You know about the Dravyas, but you don't write the all much, so much of answer you will be not writing unnecessarily. The reference, is there any text you know about the Ganas or Vargas? According to Charaka Samhitas, in 50 Mahakashaya Ganas, according to Susruta, so many Vargas. When possible, you have to write in the reference. There will be confidence will be increased. Tips for preparations, the study material, you have to write standard books. Some of the authors, you have to misguide the students. You have to know standard books, textbooks, you have to class notes. And Ayurvedic, you have to read the classics. Then commentaries. You have to use that books Lagutre, Braatre, it can be used. Then you have to write notes, either maybe teachers given by the notes. You have to refer in some other points. Some of the teachers miss the one sentence or one point. You have to getting there is good knowledge. In practice, slowly preserve a question paper. Previous year question paper in NCSM, you are a first batch students, try and error. No, you have to write according to NCSM, clear cut. You have to mention the what are the MCQs. It comes under this. Much of questions comes under the Dravyaguna, Virya, Upakas. The examiner will be, university will be analysis. Then you have to setting question papers in different aspect. There will be 4 long essay questions. There will be comes under the guna, karma, and rasa, and principle of pharmacology, general principle of pharmacology. There will be 4 content or 4 topics. 4 question will be comes in this way in these chapters. So already NCSM you have clear cut, you have to framework and already done in the your syllabus. You have to previous year question paper, you have to solve the question paper, nothing will be happen. There will be, you have to motivate or you have to write the question, solve the question papers. This much of earlier, you have to 10 marks, 2 questions, 5 marks or 3 marks. No, you have no MCQs in that in earlier syllabus. In your syllabus, your MCQ will be there in the 20 MCQs, then 4 long essay, then 8 short essay. Revision, you have to focus on the revisions. You have to, you know the by the slokas, Dravyaguna, Rasa, Virya, Vipaka, definition, Lakshanas, and types and importance. Some of the people are importance. There will be, for example, Dravya Pradhanata, you have to write the Dravya Pradhanata. It is superiorly in the all the context of the Dravya is supreme. Yes, Dravya is supreme. What are the, you have to use the, there will be qualities of Guna Pradhana. Likewise, you have to use the, that you have to comes under the, on the aspect of the, in Rasa Prabhava, all the Apto Upadesha, Sankhya Baulya, Karma Baulya, like that, you have to different importance of Dravya, Guna, Karma, Rasas. Focus on high-end topics, and you have to use on the right. Most of the people, students are not writing properly. Even after COVID, you have to suffer the lot. Most of the students, laziness. Don't do the laziness in the final examination. You have to collect the material. You have to write it once or 2 times or 3 times. Then you have to practice. In practice diagram, in suppose some of the in the earlier you have to use the write in detail about it. Any, for example, Dravya or Guduchi, for example, Guduchi, Ariteki, whatever it may be, Nimba, write it neat diagram. Their diagram will be so much horrible. You have to practice diagrams also and write it Sanskrit terms in Sanskrit only. Or you have to translate English. Don't, you have to use the Devanagari lipis. You have to create flashcards and quick review. You have to revision. You have to buy the common mistake to avoid. You have to write the in different already university given the numbers, question number will be printed. Some of the people are you have to mistake or knowingly or unknowingly. The question number will be three. You have to write in only one in question number 1. The answer will be 3. You have to write in the question number 1. Don't avoid the mistakes. This is a common sense or common. You have to use what you write. You know about the 10 marks questions. You have to more than 4 pages. 5 pages will be maximum. In 5 marks short essay, 2 or 3 pages will be sufficient. In MCQ, only 2 lines you have to sufficient. One MCQ, 1 or 2 lines. So avoiding the mistakes, silly mistakes. You know about the mistakes, but you purposely or knowingly or unknowingly, you have to do the mistakes. The common mistakes you have to avoid the leaving questions. Some of the people, some of the students are you have to know about the answer, but you have to not write 10. Why? There will be laziness of that boy or girl. Unnecessarily, you know the questions, but you have to not write properly. Some of the students are like that. Some of the students unknowingly you have to write all the 50 pages. Why you are sitting in the 3 hours, you have to write it, whatever it may be. You have to write all 50 pages. So unnecessarily, right? Or either maybe you have to study or not. Writing irrelevant content. You have to write properly. You have to, what is the question will be there. You have to write according to questions. Ignorance of the diagrams and visual ads and whatever it may be. So some of the students are you have to blunder mistakes. Either maybe phobia or whatever it may be. So in this aspect, you have, if necessary, you have to write it neat diagram. Lack of Sanskrit terminologies. Some of the almost all textbooks you have to the lack of Sanskrit terminology. You have to avoid. You have to don't write other either maybe in vata, gout or whatever like that. Some of the books are like use that words. So you have to use Sanskrit language, Sanskrit pada or terminology. It can be used. Whenever you have to necessary, you have to use the Sanskrit terminology. You don't know you have to write on the English. Then you have to all this aspect you have to know about this standard books I already over. Hello,
Sir.
sir. Are you visible or not?
Yes, sir. It's audible, sir.
No. Slide.
It's visible, sir.
There will be problem. Yeah, almost all content. One question paper will be modelized. Question paper will be put on the in your WhatsApp, whatever it may be. I will share with your screen. Some technical mistake will be there. Kiran Kumar sir.
Sir. Sir.
I will share with you.
Okay, sir.
There will be a mistake in the technical mistake will be there.
No issues, sir. No issues.
Is there any asking the questions you can?
Yes, sir. We'll wait for 2 minutes. If
Okay.
people post any question in YouTube live, I will pop it on the screen, sir.
Good.
Sir, there was no doubts were mentioned, sir.
Okay.
Next, I would like to introduce our
Wait
mentor,
1 minute.
Dr. Padmavati Venkatesh Kulkarni, Professor, Department of Panchakarma, Ayurveda, Mahavidyalaya, Hubli, Karnataka. Pranta Pramukh, Jignasa Karnataka North.
Actually, doubt though. At the end of session, we will ask.
Am I audible? Am I audible?
Yeah,
Yes,
madam.
Namaste, all of you.
At the end of session, we will ask.
Am I audible?
Ma'am, you are audible, ma'am. You can continue, ma'am.
Am I audible?
Yes, ma'am, you are audible, ma'am.
नमस्ते all of you. आज कितने स्टूडेंट ज्वाइन हो चुके हैं यूट्यूब पे? Am I audible?
Ma'am, you are audible.
Namaste. Firstly, I congratulate all of you for joining this Jignasa forum. The title itself suggests that you will be Yashasvi after joining. Yashasvi Bhava is our title. With our blessings, with our efforts, with our selection of proper speakers, which we have selected across the Karnataka, the best of best faculties we have selected for you. Make use of it, practice it. As sir was telling that you should avoid certain mistakes and you should concentrate more on certain things, that all the instructions you need to follow. And I'm very much thankful to Dr. Bingi sir for accepting our invitation and helping for my all second year Rajiv Gandhi University exam going students for their preparation for the exams. I wish you all the best. Thank you.
Sir.
Thank you, ma'am.
Yeah.
Thank you for conducting a wonderful session, sir. Your expertise and enthusiasm made the topic engaging, and it was very useful and helpful for students. We appreciate your dedication and passion for teaching. Thank you once again, sir.
Thank you, madam. Giving an opportunity of Jignasa team, coordinator Kiran Kumar, Nirmala madam, and Padmavati madam. Thank you, one and all.
Thank you, sir. Seventy
Kiran, live stop ಮಾಡು.